Hello everyone, welcome to OSCEtrainer.com. Today we are going to deal with a video on the ANTT, which is one of the important procedures for the NMC OSCE. So let's begin. So ANTT means Aseptic Non-Touch Technique, and recently the time limit for the ANTT has been reduced from 17 minutes to 15 minutes. So the new time limit is 15 minutes. Okay, so as we go deep into ANTT, the first thing which comes into mind is how to perform ANTT for the NMC OSCE. So we're going to deal with a few steps where you can perform the ANTT. The first and foremost step is checking the scene safety. As you enter the room, you check for the scene safety. So you can do that by checking the scene and identifying any hazards. The next step is hand hygiene according to the 7 steps by WHO guidelines, and then you introduce yourself to the patient. Along with that, you have to ask the patient what he or she would like to be called as. So here are some of the few steps which you have to follow, and these are the most important ones. So the first one is the ID check, where you have to check the identification of the patient with the wristband and check for the date of birth as well. After that, you will be asking the patient what he or she prefers to be called as. Later on, you will be calling the patient that name. Later, you have to gain verbal consent of the patient for the procedure. Then you'll have to assess the pain of the patient using the pain scale from 0 to 10. Check for any allergies using the allergy band of the patient, if any. Then the most important step is to provide privacy for the patient, and you have to check whether any fans have been switched off and that you have stopped the domestic activities. So after completing all these steps, you can move forward. Then we have to do the wound and linen inspection and verbalize that it is clean or if it's not. Then we have to do the assembling of the articles and follow strict aseptic technique for the hand hygiene, and you have to do the 7 steps recommended by WHO guidelines each time you do the hand hygiene. Then next comes the cleaning of the trolley, which is also quite important. You have to clean trolley from farther to nearer end and from top to bottom shelf. There are a few articles which you need for the procedure. So the main articles you need for the dressing include the dressing pack, saline sachet, alcohol swabs, and bandage. And the articles needed for the nurse include a clean glove pack, hand rub, extra apron and sterile gloves if needed. And there are a few things which you should never forget for ANTT. Check the expiry dates of all the items which you take for the procedure. Check for any precipitate in the saline sachet. Check for intactness of the articles. Take an extra pair of sterile gloves if required. Most often candidates find it difficult to insert the gloves using the sterile technique. So even if you fail an attempt, then if you have an extra pair of gloves, you can use that one. So it's going to be a lifesaver. Alright, so what goes next? You have to wear the apron and then wear the gloves and loosen the old dressing and open the dressing pack using the sterile technique. It means you should never touch the inside of the pack. Always be careful and touch only the sides of the pack. That is the outer side, not the inner side. So open without touching inside. Wear the apron. Use plastic bag inside the pack to segregate the items, assuming that it is your gloves. Use the same bag to remove the old dressing and turn it inside out. Stick the bag to the lower side of the trolley. Clean the saline sachet for 30 seconds and dry it for 30 seconds. Pour the saline into the tray within the pack. Open the adhesive dressing into the pack. Open extra gloves if needed. Do the hand rub and don the sterile gloves. Put the drape beneath the wound. This is one step which most of the candidates forget, so be careful about that. You have to utilize the drape and it has to go beneath the wound without touching any key parts. Then you have to verbalize clean hand and dirty hand, which is very important. And candidates can consider their hand which is closest to the patient as the dirty hand, and the other one which is closest to the tray with the sterile pack as the clean hand. And using the dirty hand, clean and dry the wound and state the wound condition. Release and open half of the dressing with the clean hand. Apply dressing with clean hand and minimal assistance of the dirty hand. Inform the patient that the dressing is being done. Discard all the items into the clinical waste and give the call bell to the patient and document the ANTT procedure. Perform hand washing according to the WHO guidelines. And a few important steps which you should never forget as well are the patient identification, sterile technique, stating the wound status, proper hand washing technique, proper waste disposal, maintaining the privacy of the patient, usage of clean and dirty hand, sterile gloving technique. Visit our website www.oscetrainer.com for free OSCE materials and videos. Thanks for watching. Bye-bye.